Can you take Levodopa if you have glaucoma? In this video, I will explain you the contraindications and the relative contraindications of using Levodopa in patients with glaucoma in the context of Parkinson's disease in less than 5 minutes. First of all, let's start defining glaucoma. What is glaucoma? Glaucoma is a condition that affects the flow of the intraocular fluid, leading to potential vision loss if untreated. The problem is that the flow is not working well, leading to increased pressure inside of the eye and damaging the optic nerve, which in my opinion is the most important cranial nerve. I personally prefer to be deaf than blind. Remember, this is not the same as cataract, which is another eye condition and the most common cause of blindness. Glaucoma is the second most common cause of blindness after cataract. There are few types of glaucoma. We are going to talk about only two of them. The first one is, and the most important, because it's the most common, is open-angle glaucoma, which affect approximately 90% of the patients with glaucoma. The second one is what we call closed-angle or narrow-angle glaucoma. Is rare but might occur suddenly when the pupil becomes too big too quickly for any reason, including the use of some medication that cause or trigger this problem in susceptible patients. In other words, some patients are predisposed to this problem. This type of glaucoma might cause acute onset of eye pain, redness, and unilateral headache, very severe, and require ophthalmology consult stat. When I say stat, immediately, not tomorrow, not the next week, no, now. Another type of glaucoma is the one that we call normal tension glaucoma or the congenital glaucoma. And also we have mixed glaucoma. Why I'm talking about this issue? Well, the problem is that I had a patient who told me that she was told by an optometrist to stop the Levodopa because she has glaucoma. I'm not sure if this was a misunderstanding, but let's assume that this was a misunderstanding. What do you think will happen if she stopped the Levodopa? Well, she might have a severe withdrawal syndrome, and we call that Parkinsonism hyperpyrexia syndrome that you will see here, which can be a life-threatening situation. In other words, you might end up in the hospital very sick. If you taper down the Levodopa, this is not going to happen. However, if you have a patient with Parkinson's disease and you stop the best medication that we have available to treat Parkinson's disease, you are not going to live as long as expected, like the era when patients used to die before Levodopa was available. Let me tell you what is the difference between an ophthalmologist and an optometrist. An ophthalmologist is a physician. When I say a physician, I mean an MD or a DO. So those doctors, they go to medical school after having an undergraduate degree. After medical school, they do 4 years of training in ophthalmology, including an internship, and many of them they do a super specialty, which is a fellowship. In this case, a glaucoma fellowship. An optometrist, they are not physicians. They go to optometry school, which is approximately 6 to 8 years after high school. By the way, ophthalmology residency has traditionally been one of the most competitive medical residency. Now let's answer the question. Is Levodopa contraindicated in patients with glaucoma? Well, Levodopa is only absolute contraindicated in patients who have narrow-angle glaucoma before having cataract surgery or laser surgery, by which the ophthalmologist create a tiny hole in the iris using a laser to open the angle. Let me repeat that again. If you have the open angle glaucoma, no issues, no contraindication. You can take levodopa without any problem. Now, if you have the close angle glaucoma, which is very rare, this is very important to differentiate them, then you cannot take the levodopa unless you are being seen by an ophthalmologist. You need to be supervised by an ophthalmologist. Preferable somebody fellowship trained in glaucoma if you have already the diagnosis. I know I already passed 5 minutes, but I want you to know how to find a glaucoma doctor. When I say a glaucoma doctor, I mean an ophthalmologist fellowship trained in glaucoma. If you see my area, Knoxville, Tennessee, there are only, around my area, 50 miles around my area, there are only 4 glaucoma doctors. How I end up with this page? So I went to this website, American Glaucoma Society, and I type city, Knoxville, state, Tennessee, 50 miles, and then search, and you will see the page that I just showed you. If you like this video, don't forget to subscribe to my channel. See you soon.